Hi, you guys. Welcome back for our daily practice questions. It is day 225, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q-banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient-by-patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number 1 for today. But don't forget to hit that subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. Also, my website is linked in the description of this video as well, and it houses all of the resources that I offer. But I always say also go check out my business profile on Google if you're looking just to go to one designated spot to access all of the things that I offer. So just search The Nursing Studio and you'll be able to find my telephone number to either call or text for services. You can get the direct link to the website. You can review testimonials from previous students, and everything is housed in one location. All right, y'all, question number 1 for today. A 15-year-old presents with sudden scrotal pain and absent cremastic reflex. What is the next step? Is it A, start antibiotics? Is it B, scrotal ultrasound test? Is it C, immediate surgical exploration? Or is it D, NSAIDs? Take a moment and tell me what you got, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So here the stem of the question states, what is the next step? So like I always tell y'all, this is still talking in the form of treatment, planning, management, right? No matter how they phrase it, I always say if they're looking for a treatment, run it back and see if they provided you with a diagnosis. And in this scenario, they have not. So when we don't see a diagnosis, you have to run it back a step further and look at those assessment findings, right? So we have a 15-year-old, has sudden scrotal pain and absent cremastic reflex. Y'all, this is classic for testicular torsion, right? So how do we treat testicular torsion? Your best answer is C, is immediate surgical intervention, simply because if not, there can be necrosis as the spermatic cord is twisted and there's not adequate blood flow, okay? All right, question number 2. A 28-year-old male has been diagnosed with epididymitis. What is the best outpatient treatment? Is it A, ceftriaxone plus doxy? Is it B, levofloxacin? Is it C, azithromycin? Or is it D, Bactrim? Take a moment and tell me what you got in the comments, y'all. All right, stem of the question here. What is the best outpatient treatment? So again, look to see if they provided you with the diagnosis. And in this question, there is a diagnosis provided. The patient has epididymitis. So when you're thinking about epididymitis, also pay attention to the patient's age. This patient is 28, so your best treatment is going to be A, your ceftriaxone plus doxy. Remember, when you have patients 35 and younger, you want to consider that the epididymitis might be secondary to an STD. So typically they'll go with ceftriaxone as a treatment option to cover potential gonorrhea as the source, or you'll see them giving ceftriaxone plus doxy to cover gonorrhea and chlamydia treatment options, okay? So you'll see those options covered for treatment of epididymitis for those 35 and younger. All right, and lastly, question number 3. A 56-year-old male has been diagnosed with epididymitis. What is the best treatment? Is it A, Cipro? Is it B, amoxicillin? Is it C, ceftriaxone? Or is it D, metronidazole? Take a moment and tell me what you got, y'all. All right, and so stem of the question, what is the best treatment? So again, when the STEM is looking for a treatment, look to see if there's a diagnosis. And there is. This patient has also been diagnosed with epididymitis, but in this scenario, he is 56 years old. So he's older than 35, so you can go with a fluoroquinolone. So A is your best answer, ciprofloxacin. Make sure you pay attention to the age. I always tell y'all, when you're reviewing your assessment findings, look at those three factors: age, gender, and ethnicity. This can contribute to how you diagnose and treat. Don't just skim across that and think that that's just contributory information. Slow yourself down, pay attention to the keys and process, and see if there needs to be anything adjusted based off of any of those criteria. All right, y'all. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio. You can give us a call, shoot us a text message, shoot us an email. And as always, my website is linked in the bio of this channel as well as in the description of this video. And like I mentioned previously in the video, you can also go directly to Google and just search the nursing studio. And my business profile will show all access to how to contact or how to see the options and things that I provide. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.